Enhance and rejuvenate at the McCollough Medical Spa, the Wellness and Rejuvenation Center at the McCollough Institute. The McCollough System of Rejuvenology uses an integrative approach to enhance surgical results by blending non-surgical treatments to achieve a more balanced and beautiful you. Recapture the glow and inner radiance of your skin at any age with a variety of deep cleansing or soothing facials. Go a little deeper with microdermabrasion, IPL, or laser treatments. Soften frown lines with Botox. Add fullness with Perlane, Restylane, and Juvederm injectables. Unlike traditional day spas, the new McCollough Medical Spa can also assist you with weight management, nutrition analysis, and hormone testing. A synergistic approach to health and balanced beauty awaits at the McCollough Medical Spa, the ideal place for relaxing and rejuvenating the mind, face, and body, right here on the Gulf Coast in Gulf Shores, Alabama. Hello everyone, I'm Malia Allen from the beautiful McCollough Institute of Appearance and Health, and I'm in the offices of Dr. E. Galen McCollough, who is my guest today, and I'm so excited to be back in your offices, Dr. McCollough. You know, I always like to describe you as, you know, you've got this, you're this visionary, you're an author, you're an athlete, and kind of an architect for the face. I learned that about you in the last show, that you really wanted to be an architect.
I almost was an architect. I had committed to go to Georgia Tech and play football at Georgia Tech. Mm-hmm. And then Coach Bryant came along in the recruiting process and promised me a national championship ring. And so I ended up going to Alabama and got the ring. So I went into medicine actually as a second choice. But once I got into medicine and I saw that plastic surgery was a specialty, there was never any question but what I was going to spend my life doing after that.
I guess there's not a lot of difference between being an architect and a plastic surgeon. You have to have that visual of the end in the beginning, right?
Yes, you do. You have to be able to look at something and see what the end result is before you start it. That's what an architect does. You look at a piece of ground and then sees 2 or 3 buildings on it and then maps them out, and then the client decides what he or she wants. We do the same thing. We get the patient in front of a mirror, a 3-way mirror. We demonstrate to them what we think needs to be done, and then we proceed accordingly.
Now, we did a show, and a lot of our viewers at home remember our last show. It's been how many years now?
5 or 6 years.
5 or 6, and I'm going to ask you the same question I ask you every single time I see you. It's the same question. Is it time yet?
No, it's time for me, but it's not time for you.
I look in the mirror and I see this, so you know it's not time yet.
Not time. I told you, I'll tell you when you're ready.
You're going to let me know.
You're not ready yet.
Okay, I'm going to hold them to that. I have to say that since our last program, it was an hour long, we go into depth, we talk about you and your wonderful athletic career and how you worked with Paul Bear Bryant. It was a fascinating story, and I kind of talked you into letting me tell that part of the story. But I have had so many men in particular come up to me and say, I love that gentleman, I love that surgeon, I watched the show from beginning to the end, and I've watched it more than one time. Have you had that kind of feedback?
We actually have. We've had women come in who tell us that their husbands called them to the TV room and said, I want you to come in here and watch this show. You've been thinking about having some work done, and I want you to come and watch this show. And so as a result, yes, the men and women have both come. It's amazing that about 1/3 of our surgeries are performed on men. So the men out there are watching this program just as much as the ladies are.
I can tell you for sure that's a fact. Yes, they are. And they all say, you know, if I was going to have facial plastic surgery, not when, if, I would let him do it. I would have Dr. McCollough perform the surgery.
Well, I'm honored that they would say that, but I have a wonderful staff of people here, and I do think that we probably take better care of people, and we try to treat people like we'd want to be treated if we were on the other side.
You've always had a unique vision for the McCollough Institute, and that started back when you first opened your practice in Birmingham, Alabama, and you had the on-site surgical center and recovery facility, which you've duplicated here in some ways. But you've also added to that overall vision. A few years ago, you told me that, you know, Malia, I want to address the issues of the whole body, and I want to round out this practice, and you've done that. So we're going to be introducing a couple of new doctors today, right?
Yes, we are. I have added to our staff 2 really bright young people who are going to be superstars in their own right. And I'm just delighted today to introduce them to our audience out there and to you, and let you get to know them a little bit and find out what their passions are and what they intend to do and have already done since they've been here, part of our institute.
And you're now offering a lot more comprehensive services than you had before with the facial plastic surgery and the rejuvenation that you did before. So we'll be talking more about some of those procedures that you're now offering. But before we get to that, I want to ask you this kind of overarching question, because people ask me this all the time and I often ponder it. What is beauty, and is it more about wholeness or is it more about perfection? What do you think?
Well, I think beauty is a lot about harmony. And that's harmony, whether or not it's in our lifestyle, whether we balance everything within moderation. It's also important in how we look. And beauty is not only what Da Vinci described as the perfect features, but it's how we sit, how we stand, the clothes that we wear. Are they well coordinated? Do they fit well? How we wear our hair. Do we look groomed? Do we have a pleasing smile? Our character, our weight. It's a whole group of things that when it all comes together, it's beauty. And that's what we're about, is trying to deal with the whole aspect of human beings, the mind, the body, and the spirit. And I think that James Allen said it well. We've talked about it many times. The body is the servant of the mind. And inside our mind is where our spirits live. And I think when you think that way, when you think of ourselves as being a total creation of mind, body, and spirit, it gives us a little bit different image of ourselves, and it really puts a responsibility upon us to live up to that.
That's right. And you know, I commented to you before we turned cameras on that when I feel better about myself aesthetically, I treat people differently. You know, I'm kinder. I don't know why that is. I think a lot of people would say the same thing.
I think it's confidence. When you know you look better, when you know you're presenting your best face or your best foot forward, it gives you a level of confidence that when you interact with other people, I think you're more relaxed when you do it and you're more approachable.
Right. I think so. Now, we have some befores and afters because our folks at home love to see your befores and afters. Those are really good because what I love about these, and I don't know who our first person is going to be. Who's our first patient, Dr. McCollough?
John would be our first patient. John is an executive.
Okay.
And he came in and wanted to, he said he was looking a little bit beyond the years that he felt, and he wanted to have some work done. So we did a little bit of work on John. We did some work on his neck, and we lifted up his cheeks, did some work around the eyes, and took away some of the drooping skin to give him a much more youthful look. And I think we have the after results following the surgery. And John was very open about his surgery, and he actually gave me permission to talk about his case and to show his before and afters, not only on this show, but in our book. And it's the book, The Appearance Factor, that we give to all people who are interested in learning more about it. Whether or not they have us do their surgery, we give them the book so that they can learn more and ask good questions.
Plus, it's educational. You know, you learn more about the procedure itself, the aftercare, and really asking yourself why you're doing the surgery in the first place.
It does. We give them a lot of information ahead of time because I think the better prepared the person is when they go into the surgery, the more relaxed they are because they know what to expect. Right. And then we give them the postoperative the postoperative instructions so they know exactly how they need to plan for the recovery period, their limitations when they can resume activities, and all of those things that they need to know anyway. And we like to give that to them ahead of time.
Certainly. I really love his outcome, by the way.
Well, the important thing with these results, I hope you'll see, is that they still look natural. They look like that. What I tell my patients, that if you like the way that you looked about 12 to 15 years ago, that's what you're going to look like. You're going to look like you. You're not going to look like somebody else. And we've all seen people on television, some of the famous individuals that have had surgery and following the surgery, they don't look like themselves. Right. And we don't do it that way. And that's one of the things that I can assure our patients.
I think that's one of my biggest fears, you know, when it is time for you to do a little something here. You know, I don't want to, you know, you don't want your face to look so much younger than the rest of the skin on your body. So it really is all about not looking a little bit more enhanced and having a more subtle result.
Well, you want to have a natural, you really want to have a natural look. And that's why
right.
If you look, you know, get the photograph out 12 to 15 years ago, pull the album down, and if you like that, that's how you're going to look after our surgeries.
So who is this?
This is Cynthia. Cynthia is a professional person who was looking a little bit older than she felt. And so she came in and wanted us to do some things to enhance her appearance, and we did some work around her eyelids. So with Cynthia, we did her upper lids. We did some work in the lower lids to take away the bags and sags. And then we took out some of the loose skin in her neck, lifted her cheeks, and if you can see, it looks like she had cheek implants. She didn't. That's just the tissue that used to be there that had fallen down into the lower face, and we repositioned it and did just a little bit of a tuck in her outer brow. So it just gives her a more youthful, a fresher, more rested appearance.
That's exactly what I was going to say. She looks more rested and bright-eyed. You know, sometimes you walk around, we had one of your patients who was on the show before, and they said, you know, I just got tired of people saying I look tired.
Denise.
Yep.
Wellman.
Right,
yeah.
right.
Yeah. This is Chris. Now, Chris had early aging. She had some heaviness around her eyes and some loose tissues around the cheeks and neck. And so she didn't need quite as much done. So you modify the operation to fit the conditions that are present in each patient. And then you can see there after the surgery that she has a fresher look and looks probably 10 or 12 years younger. And we did her eyelids first, and then we did her facelift actually on live television at a plastic surgery seminar in New Orleans, and we had 300 doctors watching me do the surgery, and I actually loved it. I had a blast. It was a lot of fun to do that. And Chris healed well, and she, as you can see, looks much younger and fresher.
Well, she's got a stunning result, certainly. And I think that the skin rejuvenation that goes along with, or the skin resurfacing that goes along with the facelifts that you're doing really plays a big role in the overall outcome. And I know that you're going to introduce today a new doctor, and it's Dr. Ndeva, right?
Correct. Correct. Eula Ndeva. Mm-hmm. Yeah, you're going to meet Eula here in a moment. Eula brings to us many of the things that we've had, but she really takes it to a next level. She is an expert in skincare, and she's actually invented some products of her own, and she is a walking example of the fact that she knows what she's talking about with skin. And that's not all she does. She does a lot of other things, too, along facial plastic surgery circles. But some pediatric, you're going to see some things that she's done, a procedure that she's helped innovate for children with deformed ears to correct those ears without surgery. So you'll get a chance to see her in just a little while.
All right. So stay with us and we'll be back.
For your free e-consultation or more information about the McCollough Plastic Surgery Clinic at the world-class McCollough Institute in beautiful Gulf Shores, Alabama, simply go online to McColloughPlasticSurgery.com and download your free copy of Dr. McCollough's book, The Appearance Factor, or call 1-866-876-7600 and request your free copy of the Ultimate Consumer Information Guide to Becoming a Better You.
My name is Malia Allen, and I'm an on-air talent and producer at Blab TV. The way Blab can help a business owner differentiate their business from their competitor is it allows them to tell their story and how they're different. And I think it's that high-profile visibility that you get from doing a longer format show. People feel like they can walk up to you and they think they know you. Blab can afford that personability from a business owner out to the community. I'm Malia Allen, and I am Blab TV.
It gives me a great deal of pleasure to introduce you to the newest member of our staff here at the McCollough Institute and Plastic Surgery Clinic, Dr. Eula Ndeva. Dr. Ndeva comes to us from Richmond, Virginia. So let us learn a little bit about you.
Dr. Ndeva, before we turn the cameras on, you and I were chatting a little bit about your fascinating childhood. You grew up in Russia.
I did.
Yeah.
I grew up in the suburbs of Moscow, and I lived there until I was 12. And I moved to the United States at the age of 12. It was actually due to a family tragedy. My uncle, who was my mom's brother, had lived in America, had a family, had a 2-year-old son at the time. And when he came back to Russia to visit us, he died in a car accident. He was killed by a drunk driver. So that was devastating to my family. So we picked up and moved to the States in order to stay close to his son, who basically grew up as my brother from that point on. So I started a new school system in the middle of 6th grade. My mom had to relocate and start a new job, and we were fortunate enough to be able to live in this great country from that point on.
And I understand that you went to, from there, you went to Virginia Commonwealth University.
Yes, ma'am. I did.
And then ultimately were such a phenomenal student that you went on to medical school there.
I did. All of my training was done at Virginia Commonwealth University, and I was also lucky enough to get a scholarship that carried me all the way through medical school. And I ended up matching there for residency as well. So all of my medical training was done in Richmond.
What made you decide to go into the head and neck field of surgery?
Well, my path to being here was a stepwise approach. So what I always knew is that I wanted to be a physician from the time I was little. Then when I got into college, I knew that I had wanted to do something surgical because I shadowed a lot, and a lot of my free time was spent in the hospital shadowing various specialties. So at that point, I knew that I wanted to do the procedural rather than the medical management of patients. And after I got into medical school, again, kept shadowing different surgical specialties, and it just impressed me. My rotation on head and neck surgery impressed me. The anatomy was so intricate and delicate and very challenging, which is also why I think I was so drawn to it. So from that point on, I knew I wanted to do head and neck surgery. Then my decision to pursue facial plastic and reconstructive surgery in particular was an evolution of the different patient encounters I had from that point on in my early residency training.
Dr. McCollough, how did you come across Dr. Ndeva and her training? And I believe she came down here and did a fellowship with you, right?
She did. We are one of about 40 centers in the United States that offer fellowships. Fellowship is the highest level of training that a physician can obtain. And Dr. Ndeva came. There were 12 or 13 doctors that came and interviewed, and she stood out among all of them at that time. And so we invited her to come, and she spent a year doing fellowship with us here. So we got to know each other. She got to know a little bit about us. Mm-hmm. And toward the end of her fellowship year, I invited her to stay, and I'm surely glad that she said yes.
Dr. Ndeva, what was your experience like with Dr. McCollough? What did he teach you?
Well, it goes both ways. I was welcomed with open arms at the Institute, as well as this community in general, which I knew very little about, and moving here on my own was a little hesitant, but it ended up being one of the best decisions of my life. Dr. McCollough, first off, started off just being very, very generous in his teaching. So every step of the way, I was able to learn from him, not only surgical, but a lot of other aspects of the art of relating to my patients, communication with not just patients, but people, dealing with people in difficult life instances as well. Mm-hmm. So I feel very lucky that he's my mentor in so many ways. And obviously the technical aspects, so surgical expertise, we're taught live by assisting him. That's the best way to learn. And then gradually I got to perform my own procedures, and here I am now, independent. So.
And you are also, in addition to being a fellow surgeon, you're also running the skincare clinic. Is that correct, Dr. McCollough?
Yes, ma'am.
So what other procedures have you brought to the practice to round out this full vision of the McCollough Institute?
Well, it all started with what I believe is a very large emphasis and importance on basic skincare. Rigorous medical grade skincare is important for various patients, younger patients, older patients, those that have never had surgery, to prolong the changes that occur with aging, and as well as for people that have had surgery. I think one of the common misconceptions is that once you have surgery, you've had your surgery and your enhancement surgery and you're kind of done, but that's not the case. I think in order to maintain that surgical result, prolong it, and just optimize your health, it's important to take care of your skin. And taking care of skin doesn't just mean applying topical lotions and potions. It's really important to look inside and treat yourself from within. Mm-hmm. And the way that we are doing that is beginning with micronutrient testing, hormonal testing, just general assessment of general health and diet. That's all really important in just the overall health. So it's not, if you're not healthy within, then it'll never show.
And
no
it
matter
always
what you
shows
apply.
on your skin. Ladies, if
Yes.
you're at home, you know exactly
Yes.
what Dr. Ndeva is talking about. When you go through those hormonal changes, I know for me personally, my skin got drier, my hair got more brittle, and I thought, what is going on with me? These are different, these are differences, and I had my hormones checked, and they were very, very low. Not to mention I wanted to go home at 2 o'clock every day and take a nap. Yes. But those things all play out on the skin. One thing that I always marvel and with Dr. McCollough's procedures is you have this beautiful surgical result, but then you still have issues sometimes with skin texture. And so the surgery plus the outpatient or in-office procedures like microneedling or skin resurfacing procedures really enhance the surgical process itself.
Yes, absolutely. And as you know, there are 3 levels of resurfacing, level 1, 2, and 3. Level 3 is done in the operating room as an adjunct, is really a surgical procedure in itself. Now, the lower levels, levels 1 and 2, are not done in the operating room, but yes, they do very well with maintaining skin health. Microneedling, you mentioned in particular, is fairly new in our field, but has been used a lot, and there's a lot of literature on it. And I'll just give a brief overview. It involves administering a device with needles that puncture the skin, and this creates a controlled sterile injury. Now, the injury incites a healing response from deeper layers of the skin, producing collagen, elastin, and fibrocytes, which are skin cells that then enhance the appearance of skin from within and contribute to the elasticity, turgor, and the overall texture of the skin.
So basically plumping up, filling out the skin where it looks better. So I would imagine that folks who've had acne scarring, or if you're like me and you have large pores, I have a lot of visible pores on my skin, that would be hugely beneficial. Dr. Ndeva, thank you so much. I know that we've taken a lot of your time, but a couple of other things. You do cancer screenings in the office,
yes,
right?
Ma'am.
And that's kind of one of the things that you've done in the community as well. But what I found most fascinating is your work with the pediatrics and the newborns, working with the parents and the doctors to work on the ear when there's a deformity of the ear. Can you tell me a little bit about that?
Absolutely. So it's estimated that about a third of babies are born with an external ear deformity, and they're categorized in various ways, which I won't go over now, but a vast majority of these are amenable to reconstruction without surgery, with the use of ear molds. And I was taught this technique by my mentors in residency. Dr. Rajani Peterson was an advocate for that. And it involves making a splint out of just the little plastic tube and a wire, and securing it to the baby's ear, shaping the baby's ear to the splint, and then taping it down and securing it to the head. So it's because a lot of these ears protrude as well, and it's best done if it's screened for within the first 2 weeks of life, and really the first couple of days will be the most effective because the ears are more malleable at that point. So the splint is completely painless. There's absolutely no invasive procedures associated with it. And the babies come back to see me in 2 weeks, where I take the splint off. About 80% of them just go on with corrected ears.
And perfectly shaped ears.
Yes.
Right? I bet the parents are thrilled.
They are.
At that point, because like Dr. McCollough mentioned before, now you're not looking at a surgical candidate in the future for having to, and also a child not going through some of the harmful comments that you go through when you have some sort of a physical anomaly, like an ear that stands out, or one earlobe being longer than another one. So that has to be very gratifying.
It is, absolutely, especially because these conditions, ears can't be operated on until the child it's finished growing, which is around school age. So that still means the child has to go through preschool, even before they get to school age, dealing with that, yes.
What's the most poignant story that you remember working with a patient?
Well, one of my earlier facelifts, I performed on a very sweet lady that had gone through a really rough time in the past couple of years, professionally and personally, and she was doing well. She was doing well from a psychiatric standpoint, but had a really low self-esteem and just a kind of a negative outlook on life. So I performed a facelift and eye lift surgery, and she's healed beautifully. She had an amazing result. And at her 2-month follow-up visit, she was very candid with me and disclosed all of her difficulties before, and just informed me that the surgery gave her a new lease on life, a new outlook. She was making plans to do a lot of positive things in her life, and it was just the little push of confidence that she's needed for a few years now. And this is where I just really thanked the universe for enabling me to help people at this time in their life and to make them feel good about themselves.
You trusted your mentor, Dr. McCollough, enough.
Yes.
To actually have him do surgery on your own face. And I can't imagine Dr. McCollough. She's so stunningly beautiful. Do you mind if we show the before and afters?
Please.
Okay. So we're looking at your before. I'll take your before. Can I trade? No, I'm kidding. Okay, so Dr. McCollough, tell us what we're looking at.
Well, obviously, Eula has all of the features that are in harmony, but her nose was just a little bit out of harmony. She had a slight hump on the nose, and the two cartilages that create the tip of the nose were larger than they should be. And so we did just a little bit of work to take off some of the hump and then to modify the cartilages down around the tip of her nose. And I think what we have here is the after photographs, and this is probably a 6 or 7 months after the surgery. And by now she has approximately 95% of the result. Things continue to get better with the passage of time. With the nose surgery, the swelling goes away, and you can see once again what we have is a natural-looking nose that fits the rest of her features. And once again, you don't want to make the nose look so different that it doesn't fit. And we don't make all noses look alike. You make the nose fit the rest of the face. And so it's great when you're dealing with a beautiful young woman to begin with, and all you have to do is just polish the diamond a little bit.
Oh, that's a great place for us to take a break. Stay with us.
Enhance and rejuvenate at the McCollough Medical Spa, the Wellness and Rejuvenation Center at the McCollough Institute. The McCollough System of Rejuvenology uses an integrative approach to enhance surgical results by blending non-surgical treatments to achieve a more balanced and beautiful you. Recapture the glow and inner radiance of your skin at any age with a variety of deep cleansing or soothing facials. Go a little deeper with microdermabrasion, IPL, or laser treatments. Soften frown lines with Botox. Add fullness with Perlane, Restylane, and Juvederm injectables. Unlike traditional day spas, the new McCollough Medical Spa can also assist you with weight management, nutrition analysis, and hormone testing. A synergistic approach to health and balanced beauty awaits at the McCollough Medical Spa, the ideal place for relaxing and rejuvenating the mind, face, and body, right here on the Gulf Coast in Gulf Shores, Alabama.
And welcome back. I'm Malia Allen at the McCollough Institute with Dr. Galen McCollough and one of his newest surgeons, Dr. Brentley Taylor. Dr. McCollough, before we introduce Dr. Taylor, tell me a little bit about why you brought him on.
Well, I'm happy to introduce Dr. Taylor. He's been with us a little over a year now. Right. And Dr. Taylor brings to the Gulf Coast things that have not been here before. He's one of the most highly trained plastic surgeons in this area. Not only did he do his plastic surgery residency, but he did a fellowship in hand surgery, and then he did a fellowship in craniofacial surgery. So he truly brings things to this area that have not been available, and we're just delighted to have him as a member of our team here.
Happy to be here.
So, Dr. Taylor, before we get much farther, you have kind of impressive background. I mean, you're from Birmingham, Alabama, which is my hometown. So, I have to say roll tide to that, right, Dr. McCollough?
Absolutely.
You don't have to, but I'm glad you did.
Right.
We prefer it.
We prefer that? Oh, good, good. So we're on the same team then.
Absolutely.
All right. We're having a good year,
yes.
by the way. So you grew up in Birmingham and you graduated valedictorian of your high school.
I did.
You did. And then you went to college where?
Spring Hill College in Mobile, Alabama.
All right. So you stayed there and then you moved on from there. And where'd you go?
University of Alabama School of Medicine, and then University of Texas Medical Branch for my plastic surgery residency.
Now, what I understand, Dr. McCollough, is that University of Texas is very competitive and difficult to get into that program.
Absolutely. But when you've got the credentials that Brentley brought, it wasn't that difficult.
No?
I don't know about that. Yeah, I was very fortunate.
Okay, so you went from there, and was that general surgery?
That was integrated plastic surgery.
Okay.
So 6 years of plastic surgery training.
Okay, and then you went from there to Atlanta? Do I have that right?
I made a stop in Tampa for 1 year hand fellowship
All right.
for hand surgery.
And then you went to Atlanta.
Then I went to Atlanta.
All right.
And then my wife cut me off.
She said no more college because one of us has to pay the bills, right?
Well, she said, I'm tired of moving. And so let's wrap this up.
Let me ask you, why do all of these fellowships? Was it just this quest for knowledge, quest for perfection, quest for wanting to know how to do more to help more people? What was it?
Mostly the latter. I wanted to be able to go anywhere and do everything, plastic and reconstructive surgery wise. And so, I wanted to be prepared to help my patients as best as I possibly could.
So when you sit across the room from someone, you say, I could do facial surgery, I could do tummy tuck, I could do hand surgery, pretty much anything.
I guess so.
Pretty much. What has been your most gratifying moment as a surgeon?
Oh, there are so many of them. That's one of the reasons I chose plastic surgery. One of the most striking was the first cleft lip that I was involved in. You have parents who these days, most parents know beforehand, before the child is born, from the 3D or 4D ultrasounds that their baby has a cleft lip. And they're so worried about it, and understandably so. I mean, you have children, I do too, and your heart goes out to them because they're so worried about everything. And to see the relief on their face when you're done repairing a cleft lip, it makes it all worth it. It really does.
All worthwhile.
It does. And then, almost on a daily basis, the best way to compare it would be, how you can be sore from a workout, but it's a good sore. You have like a good burn and a good sore the next day. You feel like you got a good workout in. Surgery can be like that. You can spend a long, hard day in the OR and you get home and your back's a little bit sore. You're very tired. Your neck's a little bit sore, but then you think about like what you did for somebody that day and it's a good sore, like you feel good about what you did.
So we've got some incredible photographs of one of your patients, and her name is April, I believe. Dr. McCollough, why don't you set us up for this patient and tell us a little bit about the why you incorporated Dr. Taylor into the McCollough Institute, and I think she beautifully illustrates that.
April shows many of the things that we try to provide here. First of all, she was an employee. She worked here, but she worked behind the scenes because she didn't feel comfortable working out front, interacting with people. And she was 100 pounds overweight. And so she had a weight reduction surgical procedure performed to make her stomach smaller. And then after she lost the 100 pounds, not only did her high blood pressure go back to normal, her diabetes was gone and her cholesterol levels returned to normal. So that's the non-surgical component that we bring here to the Institute. And then she had a lot of drooping skin. After massive weight loss, she had a lot of skin around her abdomen. Her breasts were sagging. She had loose skin around her face. And so she had multiple surgical procedures. And I'll let Dr. Taylor talk about the surgical procedures that are required to correct those problems.
So what did the surgeons do first?
So there's always a choice in that matter. I like to go with what bothers my patients the most. And when you have a great deal of weight loss, the skin often does not follow the volume change quite as much as we would like it to. And so it can really be head to toe extra skin, especially the upper arms, the breast, the abdomen, and the thighs. So I like to talk to my patients and figure out what bothers them the most, what's going to help them the most.
Psychologically, what do they
And
see?
functionally, it's definitely both.
Okay.
And it is most often both. Okay, the extra skin can get in the way with clothing, with exercise, and things like that, day in and day out. And absolutely, there's a psychological component, what bothers them the most. And I like to tackle that one first.
Okay. What was the most beneficial here? Tell me a little bit about the procedures with April.
It was an abdominoplasty and a breast lift.
And then Dr. McCollough, I believe after that, she had some other facial surgeries, did you say, or procedures done to eliminate some of the sagging skin around the neck?
Had some work done in her neck, liposuction, because even though you lose massive amounts of weight, there's some areas where the fat doesn't go away and has to be removed surgically. So a little bit of liposuction, contouring of the neck and the jaw. And those things can all be done at the same time. Dr. Taylor and I frequently do procedures where he'll be working on the below the shoulders, and I'm working on the face at the same time, or Dr. Ndava's working on the face at the same time. And that cuts down on the cost, number one, because you only have one surgical procedure, one operating room, one anesthesia, and it also allows the patient to recover from multiple procedures at the same time. But we're careful. We don't do more than we think is wise or safe to do at any one time.
And was this patient able to recover here at the facility?
Yes.
And
everything was done here, except the lap band. That was done at the hospital, but all the rest of the procedures were done here on site. And she stayed in our villa the night after with a caregiver, which is another part of our standard of care. So no shortcuts. Everything just right by the book.
And so you're able to go right out the next day and do your follow-up visits with her right here on the campus of McCollough Institute. How valuable is that, Dr. Taylor?
I love it. I know that my patients are in good hands overnight. You know, I live a couple of minutes away. I never turn my phone off. I'm lucky that my wife is a heavy sleeper because I never turn it off, and I answer it in the middle of the night if I get a call, because I want to know immediately if something is going on. We have excellent post-op caretakers. I rarely have to worry about anything. And then the next morning I get in, I put my keys up, and I go right down to see them and make sure everything is going as we expect it to be.
About how long would a recovery from this kind of multiple procedure process would one expect?
So acutely, I prefer patients with this type of surgery to stay for 2 nights, and that really usually gets them over the hump. I like to break down recovery into 2 phases. You have your immediate post-op phase. That's usually around a week, where you're feeling sore from the work that we did. You're feeling a little tired from the combination of the anesthesia and the medications. Usually around 1 week out, people start to turn the corner. They're looking better, they're feeling better. That's when I have to
slow them down.
Yes. You got to give your body adequate time to heal well before you get out and you're, playing tennis or racquetball or golf or anything like that.
Well, if I was like April, I would look that good. I would say, yes, I'm getting out. It's time for people to see me now, right?
Getting out is fine. You just got to take it easy when you get there.
Take it easy. What's one thing that Dr. McCollough has taught you in the last year that you think is invaluable?
It's hard to pin it down on one thing. I think it's overall dealing with staff and dealing with patients and dealing with other physicians with grace. I learned stuff from him, almost every day.
Just how to deal with the patients and communicate with them.
Yeah, because every patient and every physician that you're working with, it's a unique situation. But always maintaining your grace, and he's an excellent example of that.
Well, that's a great time to take a break and stay with us. We'll be right back.
To order your copy of The Appearance Factor, call 866-876-7600 or go online to McColloughPlasticSurgery.com.
Enhance and rejuvenate at the McCollough Medical Spa, the Wellness and Rejuvenation Center at the McCollough Institute. The McCollough System of Rejuvenology uses an integrative approach to enhance surgical results by blending non-surgical treatments to achieve a more balanced and beautiful you. Recapture the glow and inner radiance of your skin at any age with a variety of deep cleansing or soothing facials. Go a little deeper with microdermabrasion, IPL, or laser treatments. Soften frown lines with Botox. Add fullness with Perlane, Restylane, and Juvederm injectables. Unlike traditional day spas, the new McCollough Medical Spa can also assist you with weight management, nutrition analysis, and hormone testing. A synergistic approach to health and balanced beauty awaits at the McCollough Medical Spa, the ideal place for relaxing and rejuvenating the mind, face, and body, right here on the Gulf Coast in Gulf Shores, Alabama.
And welcome back. I'm continuing my interview with Drs. Galen McCollough and Brentley Taylor. Dr. Taylor, you mentioned to me earlier about the psychological effects of your patients and how it's kind of a really cool to experience seeing that and seeing how someone walks a little taller. You know, we're going back to this picture of April who had the multiple procedures. She's standing taller. Her head is more erect, more upright. Her hair looks nice. What happens here?
We see this day in and day out. We have patients who are really hesitant to even come in for a consult, and they're hesitant to take pictures and go and be examined, and just you can tell that they're lacking a little bit in their self-confidence. After they recover, it's such a wonderful feeling. I really can't describe it adequately enough. When you open the door for one of your post-op visits and somebody jumps up and has a huge smile on their face and gives you a hug and tells you,
you know you hit a home run, right?
You know, especially when surgery, you go through some pain and some discomfort and you know what they've been through. And on the other side of things, they're just so happy and thankful that they made the decision to go through with it. It really, I mean, it makes your day, it makes your week.
Oh, I can imagine. Dr. McCollough, comment on that, because I'm sure you've seen that with women and men. You know, now they'll get their photograph taken, where before they would avoid the camera, right?
Yes. You know, what we do is really improve not only the longevity. In her case, I'm absolutely sure that she'll live a longer life because she had high blood pressure, she had high cholesterol, and she had type 2 diabetes because she was massively overweight. And by losing her weight, she's going to be a healthier person and improve the possibility of a longer life and a healthier life. But then you can also see that she does have more pride. Her clothes, she has tailored clothes on after the procedure, whereas she has sloppy clothes on to hide her weight beforehand. We see this transition, so it really is all about improving not only the health, but the quality of their lives. And it's one thing that you and I said in the other show, and that we talked about in the other show, and that is people who do the things that are required to look their best tend to find better health, even if finding better health might not have been the initial reason for their consulting us.
So you find better health. You were going to add?
I 100% agree. You know, we often have patients who either lose weight for surgery, have bariatric surgery, quit smoking for us to do our procedures, get their diabetes under better control, and then we find that they maintain that after the surgery. So, you know, not only do they look better from the procedures that they have, they're healthier in the long run.
Right. Maybe now they have a reason to maintain health because they look better. Right? They feel better about themselves. I know for sure. You know, we talked about this before. I'm not sure what it is psychologically, but when we feel better, when we have a good hair day, or we're in shape, or, we've gotten rid of some anomaly that, was driving us crazy beforehand that kept us away from that camera. Now we feel confident, and we're not as concerned about our appearance as we were before. That's the crazy part, because I know from a feminine perspective, that I can look in the mirror, Dr. McCollough, and that one thing on my face. No one else sees it, but I do, right? So that bothers me. And so that hinders me from opening up and becoming the communicator maybe that I would want to be, or offering all of myself. Why is that?
But that's what we do. those of us who do aesthetic surgery, Dr. David, Dr. Taylor, and myself, and all of our colleagues out there, we're more than surgeons. We have to be. One of my mentors used to call this psychological surgery. And that means that you have to understand the psychology of the people who are coming for you to have the surgery if you're going to be successful at this. And we spend almost as much time working on their self-confidence and their self-image and help building them up after the surgery as we do in the preoperative period, talking about the actual incisions and sutures and that sort of thing. So it's all comprehensive in nature. And quite frankly, that's the gratifying part of it. We literally change people's lives. And you and I talked in the other show about the vanity aspect of it. This is not vanity. This is about self-pride. And to me, the vain person is the person that can't walk past a mirror without checking and making sure every hair is in place. And it interferes with their ability to perform and function in society. But the person who tries to put his or her best self forward, there's nothing vain about that. You know, that's the body's the temple of the soul. And what would you do with the temple? You'd keep it up. You'd make it want to look sparkling all the time. You would maintain it when it needed to be maintained. And if we think of the mind, body, soul, and our bodies being the temple of our soul, it puts everything in different perspective.
I've noticed time and time again, it's almost universally true. We are, each one of us, our own harshest critics. Mm-hmm. And at the same time, we all feel better and usually perform better if we do put our best foot forward.
Mm-hmm. And we don't feel like we're lacking in an area, or we have that one thing. Let's say you have this, you're afraid to turn sideways because you do have a little hump on your nose. And that almost makes me non-engaged. I'm not engaged in life. And when this is gone, it's like you said in the first show, just get over it, get rid of it, move beyond it, get the surgery, and then walk out. And now you're free and you have more confidence. Because so equally, I think people who have these anomalies, they're the ones who stop in the mirror. They're the ones who are spending so much time going, man, if I just didn't have that, I would be this. Do you hear that a lot?
We do, but you have to be a little careful because there's something called body dysmorphic syndrome, and that's the individual that's never totally pleased. For example, the best example that anyone out there can remember was Michael Jackson, and Michael suffered with body dysmorphic syndrome. He could never be satisfied, and I thought Michael looked great after the first couple of procedures, but he continued to have things done. And our responsibility as surgeons, as physicians and facial and body plastic surgeons and comprehensive plastic surgeons, our responsibility is to look at those individuals and say, no, you don't need anything else. Right. And the best thing sometimes that we as doctors can do for our patients is to say no. It's not easy.
That's a very, very good point. What would you add to that, Dr. Taylor?
It can be tough sometimes. Mm-hmm. I like to take care of people like I would my own family. And when you run into situations like this, I try to emphasize to the person I'm working with, if you were my wife, if you were my brother, my friend, my sister, and you had this exact same situation that you're coming to me with, I would not operate. I would never let somebody do this to a member of my family or my friends. And I think that it usually can help to hit home with them a little bit more. Mm-hmm.
For them to see yourself in a realistic perspective as other people see you.
It's not just you, this is for everyone.
Right.
And none of us are expected to be perfect.
Right.
Sometimes we think that we are, but we're all flawed. And even the most beautiful person in the world, you can find something that's not quite there. They either want to be taller, or they want to be shorter, or they want to have this or that. And, our job is to keep all that in perspective.
To keep it all in perspective. We always say in my family, it's whiter teeth and fresher breath. What else do you want? It's always whiter teeth and fresher breath. There's always something, right? We talked about briefly that concept of, it's about being whole. It's not about perfection. So as surgeons, and if you could both weigh in on this, when you are looking at a patient, and you, like you said, you tend to see what you think they could look like. You differentiate that end before the beginning. What's your goal going in? Dr. McCollough?
Well, the goal going in is to do the right thing and not the most expedient thing. And it's also to be able to tell them what you think you can accomplish but you also are obligated to tell your patients what you don't think can be accomplished. And that's for a happy relationship. We talked in the first show about the long-term relationships. And the way you do that is to develop a relationship based on trust. And I think that's so important. And then, the patient has to be forthcoming too, because you have to tell us some of those things that we don't need to have to drag out of you. And it's really a partnership. It's a very good partnership between the provider and the person who is having the procedures performed.
Sure, I can imagine just with something as subjective as an aesthetic, right? What looks pretty to one person is not beauty to another.
Right.
A time when you've looked at someone and said, I think this could be done, but, I don't know that would be to your advantage.
Sure. I think one of the most common places I run into that is with breast augmentation. Mm-hmm. Going too large can not give you the best aesthetic result. It can cause you neck and shoulder pain, mm-hmm. And it can cause you complications down the road.
Right.
Okay? So one of the things I like to do is have patients bring in pictures of what their goals are, but also what they want to stay away from. Because as you said, beauty is in the eye of the beholder. And I want to have a good idea of both sides of the coin of what they're going for.
So having said that, what are some of the other procedures that you do here at the McCollough Plastic Surgery Center?
Oh, I'm kind of head to toe, mm-hmm. babies to great grandparents. So a lot of skin cancer surgeries, that's the excision and the reconstruction after removing skin cancer. Facial aesthetic procedures, cleft lip and cleft palate procedures, breast surgery, body contouring, thigh lifts, kind of on down.
Yeah, right.
Mm-hmm.
So tummy tucks, that sort of thing.
Yes, ma'am.
And like you said, in a lot of cases, and I guess that's a case by case, you can have multiple procedures. So if you're at home and you're watching and you think you might be a candidate for that, how would they go in and make an appointment, Dr. McCollough?
Well, the first thing to do is to give us a call or to go to our website. Mm-hmm. If you go to our website, and we'll put the website up on the screen, and we're in the process of revising the website, but there's a tremendous amount of information there. And in the upper right-hand corner of the front page is the Appearance Factor, which is our patient information book.
And I'm going to hold this up because this is a fantastic book.
And you can click on the cover and download that entire book. And that book's going to answer most any question that you might have about any procedure. It'll talk about the postoperative care. It talks in the beginning a little bit about the risks and the things that you want to be aware of. And then over toward the back of the book, we get into the other things that we offer here, the nutrition, the weight management, fitness. Even there's a chapter on grief and loss, because we see a lot of patients who have lost a loved one and they're trying to start their lives over again or start the next phase of their lives. And there are actually things that one can do to speed the grief process up. So that's a chapter in there. So I would encourage anybody to get the book, read the book, either online or we'll send you a hard copy, and then come in and see one of us. Mm-hmm. Come in and see Dr. Ndeva, Dr. Taylor, or me, or all three of us. Because sometimes we actually have days where a patient comes in and sees all three of us, and each of us talks to them about the things that we can offer, and then we try to put together a reasonable treatment plan. Mm-hmm. And it might all be done at one time, or we talk about the long-term process of doing this first and then something else. And, we keep cost in mind as well. We really do. We try to provide a very high quality of service and care, but to do it at a reasonable price so that it's affordable, not just to the rich and famous and wealthy. Yes, we do have some of those patients who come to see us, but you'd be surprised how many of our patients are people who work for a living and live on a budget. Oh, and they work in their surgery like they would a new car or a vacation. They save up their money for that. And so, that's what makes us feel good too, is that we really do have an opportunity to change lives.
Absolutely.
I was going to ask you if you had anything to add to that.
Well, we play well together. We're often all in the OR together, and it's like a little song and dance, and we're each accomplishing what we need to for the patient.
Right.
So it's a lot of fun.
Right. closing comments, Dr. McCollough.
Well, I just can't tell you how happy I am to have Dr. Dave and Dr. Taylor here as part of our institute. And, you know, we've dreamed of this for quite some time, and it's taken a process. And I want to be very careful about the people that I brought on board here, because I've found two people that think the same way, have the same values, both other types of values as well as the professional values as I have. And like Dr. Taylor said, we do get along well together because we have a common mindset. And it's fun to come to work every day when you've got that. And our staff and these two doctors that are here, I can just tell you out there in the audience, if you come here, we're going to take good care of you, and we're going to do everything we can to make it as convenient and comfortable for you as possible.
So you can find everything then at the McCollough Institute for Aesthetics
Well,
and
if we
Health.
don't have it yet, we're working on it.
Well, it's wonderful to be a part of your completing this vision and this picture. Anything new on the horizon?
Yes, as a matter of fact, we've been doing a little bit of hormone balancing for a while, but we have a professional coming on board that specializes in hormone balancing for men and women. And then we're looking for a concierge medical doctor. So anybody out there that's interested in coming and joining our team that's a primary care doctor, call us, because we're looking right now for the person, the right fit for this team to do some of that.
These personalities in this sandbox.
That's right.
On behalf of Drs. McCollough, Taylor, and Dr. Ndeva, I'm Malia Allen coming to you from the McCollough Institute. Thank you so much for joining us.
For your free e-consultation or more information about the McCollough Plastic Surgery Clinic at the world-class McCollough Institute in beautiful Gulf Shores, Alabama, simply go online to McColloughPlasticSurgery.com and download your free copy of Dr. McCollough's book, The Appearance Factor, or call 1-866-876-7600 and request your free copy of the Ultimate Consumer Information Guide to Becoming a Better You.
Enhance and rejuvenate at the McCollough Medical Spa, the Wellness and Rejuvenation Center at the McCollough Institute. The McCollough System of Rejuvenology uses an integrative approach to enhance surgical results by blending non-surgical treatments to achieve a more balanced and beautiful you. Recapture the glow and inner radiance of your skin at any age with a variety of deep cleansing or soothing facials. Go a little deeper with microdermabrasion, IPL, or laser treatments. Soften frown lines with Botox. Add fullness with Perlane, Restylane, and Juvederm injectables. Unlike traditional day spas, the new McCollough Medical Spa can also assist you with weight management, nutrition analysis, and hormone testing. A synergistic approach to health and balanced beauty awaits at the McCollough Medical Spa, the ideal place for relaxing and rejuvenating the mind, face, and body, right here on the Gulf Coast in Gulf Shores, Alabama.